Hello, I'm Emma, and I decided to base this project on exercise and semantic memory. So, for today's presentation, we're going to be looking at the importance of the topic and what the literature and research tells us. Then we're going to see how Alzheimer's can help us further understand memory and different areas of memory. We're going to look at the types of exercise that are known to be linked to memory and improvement. Then we're going to go into different testing that will let us see correlational information on memory and Alzheimer's and different brain areas. Then we'll look at hypothetical results, and then finally we'll talk about what we can learn from the research. So, to start off, we're just going to go into some background on memory. But basically, we know that there is a link between exercise and semantic memory improvement. So there are different memory systems. The one that we're looking at falls under the umbrella of declarative memory, and that's semantic memory. So semantic memory is knowledge about words, facts, and concepts, and their properties and interrelations. This kind of memory is known to take place in the frontal cortex, temporal cortex, and also the hippocampus. So, why is it important to look at this topic? Well, memory is what makes us who we are. It could be the difference between life or death. For example, let's say an ambulance driver doesn't remember the fastest route to get to the hospital, so those extra minutes spent in the ambulance could be the difference between life or death for the patient. And then also, it can positively impact the lives of many patients if we were able to find out how to improve memory of Alzheimer's patients. So, mostly what the literature had to say was that Alzheimer's is a neurocognitive disorder that entails acquired cognitive decline in one or more cognitive domains, but mostly in memory, although it can be physical later on in the disease. Alzheimer's affects more than 5 million people every year in America alone, and onset often occurs no earlier than 45 to 50 years of age, but obviously can also vary. Usually when a diagnosis is made, there's a steady progression that leads to patients requiring much care, whether that be in a facility or at home with family members. So overall, it was demonstrated that aerobic exercise specifically helped patients improve in their memory and functionality compared to control groups who didn't participate in aerobic exercise. Aerobic activity led to better cerebral blood flow and reduced age-related loss of brain tissue. It also lowered levels of depression and anxiety, which is related to memory problems, as people with these diagnoses often experience different periods of times where they have loss of memory. And mostly what the conflict with this topic surrounded was the types of exercise that had the best outcomes. So it would be looking at whether cycling, for example, would be better than aerobic exercise, or dance therapy, things like that. So for my study, the participants are going to require a diagnosis of mild to moderate Alzheimer's. It will be restricted to the ages of 55 to 65 years old just because they're going to be engaging in physical exercise, so we don't want it to get dangerous with more elderly patients. Comorbid diseases other than depression or anxiety will not be allowed. The experiment is going to require 20 participants per group, so that means 60 participants overall because there are 3 groups. 40 of the participants will have an Alzheimer's diagnosis, and 20 of the participants will be healthy controls. So, my hypothesis is aerobic exercise will improve the semantic memory of Alzheimer's patients by improving the functionality of the frontal and temporal cortex, but mostly the hippocampus. So, To conduct my study, the groups will be decided by random assignment. We're going to be doing a mixed methods approach, collecting both qualitative and quantitative data. The study will last 8 months long, and then 2 months after the study's end, we will have a follow-up exam and interview with the participants. So the design entails a control group, which consists of Alzheimer's patients receiving only their regular prescribed medication from their doctors. Then we're going to have the experimental group A, which is Alzheimer's patients who are taking their prescribed medication, but we're pairing this with the aerobic exercise. And then finally, experimental group B, which will be healthy participants who are engaging in the same aerobic exercise. So the experimental groups will participate in a lead aerobic exercise 4 times a week for 1 hour session. Then the SAGE memory exam will take place as weekly exercises begin, before and during. Again, the SAGE memory exam will take place at the end of each second month to compare to the baseline results. And then finally, a SAGE memory exam will take place at the end of the study period to again compare to the baseline and the other testing that we do during the study. And then finally, interviews with the caregiver and family members will happen at the beginning and the end of the study to see their thoughts and views on how the patient has either progressed in regards to memory or stayed the same or even regressed. So this is just an example of a SAGE memory exam. It's often administered to people to diagnose Alzheimer's. You can score all the way up to 22. A score from 17 to 22 is considered normal. Anything less than that is considered Alzheimer's. So you can see just the different examples there, like copy this picture, and then it'll say like at the end of the exam, remember to write that you're done the exam, but you only are allowed to do that when you're actually done. So different little tests like that. So here are my hypothetical results. As you can see, the controls who don't participate in the aerobic exercise stay the same throughout the whole, throughout each test, each memory test. And then group A, who is again our experimental group of Alzheimer's patients taking their medication and doing the aerobic exercise, steadily progress as they continue their aerobic exercise classes. And then again, experimental group B, they do steadily progress and get better at the testing memory exams as they continue their aerobic exercise. So I wanted to show that even if you don't have Alzheimer's, participating in aerobic exercise and physical activity can improve your memory, your semantic memory and hippocampus and brain functioning. So then I also would want to do an MRI scan before and after, specifically of the hippocampus because it's largely related to semantic memory. So then I would hypothesize that obviously the hippocampus of at the beginning of an Alzheimer's patient would be smaller, less functional, there'd be degeneration in that area, and then at the end of the study, it would have, you would have less degeneration there, and it would be more functional and light up more in the MRI scan. So, to go over, we want to gain knowledge about the relationship between specific brain areas and memory in this study. We know that Alzheimer's disease can show us a lot about memory and semantic memory. The results that we looked at support the hypothesis by demonstrating that regular exercise, specifically aerobic exercise, can increase the functionality of specific brain areas, the hippocampus, and memory. My results insinuate that exercise can lead to improved memory, Alzheimer's doesn't have to be as life-altering as we currently understand it as if we implement these interventions early enough after the diagnosis. And finally, the brain and memory are very plastic and changeable, and that's something that we're coming more to know now than we have before in the past. And here are just my references that I used in my research. Thank you for listening.